The Association of American Medical Colleges and the Federation of American Societies for Experimental Biology, known as FASEB, are pleased to welcome you to today's webinar, Sexual Harassment of Women, Climate, Culture, and Consequences in Academic Sciences, Engineering, and Medicine. My name is Sandy, and it's my pleasure to be the facilitator for today's event. I'd like to formally welcome the participants who are joining us today. Please note that today's call is being recorded and will be available online in 3 to 5 business days. All participant phone lines will be muted during this broadcast. If you experience technical difficulties with the web portion of today's program, please email aamc@compartners.com or send a message in the chat box. If you are listening to the program over the phone and you need assistance at any time, please press *0 and an operator will assist you. This presentation will last up to 60 minutes and will include question and answer opportunities during the webinar and at the end. You may submit a question at any time by typing into the chat box at the lower left corner of your screen and then clicking on the Send button. I'd like to direct your attention to the links box on the left side of your screen where the presentation slides are located for you to view, save, or print. Simply click on the link and a separate web browser window will open. This will not interfere with your viewing of the program. It's now my pleasure to introduce our hosts. AAMC and FASEB have partnered to launch a monthly webinar series to discuss the major findings, recommendations, and implementation strategies from 5 reports from the National Academy of Sciences.
Good afternoon. Thank you for the introduction, Sandy. My name is Amanda Field, and I am a Science Policy Specialist at AAMC. I work in the Scientific Affairs Unit at AAMC, in which my team and I focus on improving and communicating research and research training policy issues that affect our member academic medical institutions.
Good afternoon. I am Teresa Ramirez, the Diversity and Inclusion Policy and Outreach Specialist at the Office of Public Affairs at FASEB.
These 2 organizations bring you this webinar series on several National Academies 2018 reports that are relevant to the biomedical community, which you see pictured here.
The goal of this series is to not only relay the key findings and recommendations of the reports, but to provide the community with a chance to interact and discuss their concerns over and efforts to implement these recommendations at their own institutions. For this webinar, we will be focusing on the report, Sexual Harassment of Women, Climate, Culture, and Consequences in Academic Sciences, Engineering, and Medicine, which examines the present state of harassment in science, including the critical role of organizational culture, the inadequacy of the legal system to address it, and the frequently overlooked issue of gender harassment.
Today, Study Director Dr. Fraser Benya will be summarizing the key findings of the report, and then the presentation will focus on the implementation of 2 essential recommendations. The first one is addressing the most common form of sexual harassment, gender harassment, and the second, moving beyond legal compliance to address culture and climate change. This webinar will also feature speakers from the University of Michigan and Michigan State University who will discuss how institutions can implement these 2 recommendations. As Sandy mentioned, there is an open chat box that participants can use to communicate with us and with each other. So please do not hesitate to enter your thoughts or any concerns throughout the webinar, including any work being done at your institution or organization.
And now, I'd like to introduce Dr. Fraser Benya, Senior Program Officer for the National Academies Committee on Women in Science, Engineering, and Medicine, and Study Director of this report. Dr. Benya.
Thank you both, and welcome everyone. It's really a privilege to be able to talk with you all about this report, and I look forward to hearing your comments and thoughts as well as my co-presenters. I have the difficult task of summarizing this 300-page report in roughly, 15 to 20 minutes. So that said, there's a lot more that I could speak to, and I'm happy to answer questions about anything I mention later in the presentation. The first thing I want to note is that the committee's charge. So if you can move to the next slide. The committee was charged with 3 things. First, determining the prevalence of sexual harassment for women in academic fields of science, engineering, and medicine. Second, how it impacts the recruitment, retention, and advancement of women in these fields. And thirdly, determining what the most successful practices are for addressing and preventing sexual harassment. I'm going to give you the 5 key messages from this report, and then we'll go into a little bit more detail for a couple of them. The first finding from this report is that there is extensive sexual harassment in these environments. The best analysis to date shows that 50% of women faculty and staff in academia experience sexual harassment. That's half of women. For the student population, the surveys show that between 20 and 50% of women students in science, engineering, and medicine experience sexual harassment specifically from faculty and staff. And I also want to note that the research reveals that women of color and sexual and gender minorities will also experience more sexual harassment than their peers, and particularly for women of color, when they experience the sexual harassment, it will oftentimes be a combination of both racial and sexual harassment. The second key finding from the report is that gender harassment is the most common form of sexual harassment, and I'll go into some detail on the next slide about what we mean by that. The third finding is that sexual harassment undermines research integrity, reduces the talent pool, and harms both targets and bystanders, and we'll discuss that a little bit as well later in the slides. The fourth finding is that the legal compliance system that we have in place is necessary but not sufficient to reduce sexual harassment, and this is in part due because the law requires policies and practices to be in place and to be used, but not that they prove to be effective. The final finding from this report is that we can actually make a difference by changing the climate and the culture, and doing so can actually prevent and effectively address sexual harassment. So to start with, the committee started with what do we mean by the term sexual harassment. They reviewed social science and legal scholarship and found that sexual harassment is a form of discrimination that consists of 3 types of behavior: sexual coercion, unwanted sexual attention, and gender harassment. You can see them here overlaid on this image of an iceberg, which helps to convey the level of public consciousness around the term sexual harassment. So what's above the waterline is what people think of when they hear the term sexual harassment. What's below the waterline is oftentimes what people do not think of when they hear the term sexual harassment. So at the top of the iceberg, most readily recognizable to the public, is the form of sexual coercion. This refers to implicit or explicit attempts to make conditions of employment or education contingent upon sexual cooperation. This is the prototypical sleep with me or you're fired situation. It is often the first thing that comes to mind when people think about sexual harassment, but it is also the rarest form. Just below that, in the sort of blue triangle that cuts across the iceberg and the waterline level, is the form unwanted sexual attention. This refers to sexual advances that are unwelcome, unreciprocated, and unpleasant to the target. This can include unwanted touching, hugging, stroking, kissing, and relentless pressure for dates or sexual behavior despite discouragement. This form of sexual harassment can and sometimes does include sexual assault. In other words, the same behavior can be both a civil rights violation and a crime. All of that said, the vast majority of the time, sexual harassment takes the form of a put-down and does not have the appearance of being a come-on as the first 2 forms I described do. The most common form of sexual harassment is the gender harassment form, and this refers to verbal and visual conduct that conveys hostility, objectification, exclusion, or second-class status about members of one gender. These are comments like women aren't cut out to be surgeons and girls don't belong in engineering. It can also refer to degrading images and words in the ambient environment. Now, the gender harassing conduct, as I noted, is below the waterline in this image because, as with icebergs, what's underwater is crucially important and rather dangerous. It might be tempting to assume a continuum of severity with these behaviors. For instance, that what is at the top of the iceberg is somehow worse than what's at the bottom of the iceberg, but the committee reviewed that evidence and found that those assumptions do not hold up to scientific scrutiny. Instead, they found that even when sexual harassment entails nothing but gender harassment, it takes a toll on victims. In fact, severe or pervasive gender harassment does the same professional and psychological damage as an isolated instance of sexual coercion. So the question then becomes in most people's minds, okay, so it's common, but how damaging is this behavior? The committee found that sexual harassment undermines women's professional and educational attainment and their mental and physical health. The more often women are harassed, the more they report symptoms of depression, disordered eating, stress, anxiety, and physical complaints like headaches, exhaustion, and sleep disruption. In one study, it found that 1 in 5 sexually harassed women will meet the criteria for major depressive disorder, and 1 in 10 will meet the criteria for post-traumatic stress disorder. In another study looking at just exposure to sexist comments, so just the gender harassment piece, they found that it triggered greater cardiovascular reactivity, which over the long term can put women at increased risk for coronary heart disease and depressed immune functioning. When it comes to women's professional and educational attainment, dozens of studies have made clear that sexual harassment derails women's work lives. When women are sexually harassed, they find their job less satisfying and more stressful. Many engage in some form of work withdrawal, meaning they remain with their institutions but disengage from the work. Others will simply leave their institutions to take positions elsewhere, but sometimes to leave their fields altogether. All of this is done in an effort to escape an abusive situation. The picture is just as bleak for women students as they take various measures like leaving their courses, dropping out of school. In addition, the committee found that one need not be directly targeted with sexual harassment to feel its effects, because the circle of harm extends to both witnesses and work groups. Research shows that people who merely see sexual harassment targeted at others in the same setting will report negative outcomes that parallel those of direct victims. Those same work withdrawal, the same mental and physical health damages. So the question then becomes, what are the most effective ways to address sexual harassment? And the committee found that it's organizational factors that are most significant, and there's 2 large ones that create the greatest risk for sexual harassment to occur. First is whether an environment is male-dominated, and this can be created in terms of overall numbers or representation in the organization. It can also be if just the leadership alone is male-dominated, and a good example of this would be in the academic medical setting right now, where we've been at gender parity at the medical student level for a number of years, but the leadership in medicine is still male-dominated. The third way it can be male-dominated is if culturally it is seen as abnormal for women to do the work. The second risk factor for high rates of sexual harassment is an organizational climate that conveys tolerance for sexual harassment. And the researchers identify 3 characteristics that create this environment. The first is if the community perceives that reporting is risky. Second, if the community perceives that reports are not taken seriously. And thirdly, if the community perceives that offenders escape sanctions. I mentioned the community perceives for each one of these, and that is specifically because there is a difference between organizational culture and climate is about how your community feels that the culture and values are lived and experienced on a day-to-day basis. It is important to recognize that it is this organizational climate for tolerance of sexual harassment that is by far the greatest predictor of sexual harassment, and thus the committee used that research to base a series of recommendations. So I'm now going to switch to the first recommendation that we're going to talk about today, and that is the recommendation that leaders in academic institutions and research and training sites must pay increased attention to and enact policies that cover gender harassment as a means of addressing the most common form of sexual harassment and of preventing other types of sexually harassing behavior. Now, we already covered the part about how gender harassment is the most common form of sexual harassment. I'll just note that in the surveys that study the prevalence of sexual harassment, it'll find that gender harassment is about 25 to 50% of women experiencing it, whereas the other 2 types will range about 1 to 5% of the time. The part about how gender harassment can prevent other types of sexually harassing behavior is a reflection of the fact that when women experience sexual harassment, they almost always experience gender harassment, either on its own or with the other 2 types of sexual harassment. And one of the researchers on our committee actually refers to gender harassment as the gateway drug to other forms of sexual harassment. The second recommendation we'll talk about is sort of the overarching recommendation for this report, which calls on institutions to move beyond basic legal compliance to address the culture and climate in their institutions. They also call on institutions to move beyond interventions or policies that reflect this basic legal compliance, and also that they stop relying solely on the use of formal reports to address this issue. So what follows from this recommendation are a series of recommendations that take aim at trying to change the culture and climate in these institutions based on those risk factors I described briefly a minute ago. So if we go through them, the first set is to create diverse, inclusive, and respectful environments in terms of hiring and promotion, to also pursue civility promotion programs because the research shows that high rates of incivility are tied to high rates of gender harassment environments, to use what's known as bystander intervention to interrupt and intervene when inappropriate behavior occurs, and to change our training processes so that they aim to change behavior and are not designed to change beliefs. So you can begin to see how this takes aim at the male-dominated environments, and also to convey that institutions do not tolerate this behavior. The second key recommendation is to diffuse the relationship between trainees and faculty. Particularly, the committee noted mentoring networks, committee-based advising, and independent research funding. This is not a new recommendation for an Academy's report or other reports coming out of other institutions. In this case, the committee made this recommendation because when there is a power differential between these two parties, the impacts of sexual harassment can be that much worse. The third piece of this is to provide support to targets. And again, you can see the tie back to ensuring that the community does not feel that reporting is risky. So here, the committee pointed to providing access to support services without a requirement for making a formal report. They also spoke about the need to provide alternative and less formal means of recording information about an incident and for handling a report. So the committee pointed to the use of online tools for documenting experiences, also the use of ombuds officers and restorative justice measures for addressing issues. And then the third piece of this is to address retaliation, to develop approaches that can prevent the target from experiencing or fearing retaliation. Most institutions rely solely on the fact that retaliation is illegal and stop there. But if we're serious about addressing retaliation in academic environments, then we need to start thinking about the ways in which someone can be retaliated against and then try to protect them from it. The final piece of this larger recommendation is to improve transparency and accountability. And here, again, tying back to that organizational climate, convey to the community that people are taken seriously and perpetrators face sanctions. So clear policies, including policies that list the types of disciplinary consequences that people will face if they violate them. The committee was also explicit in calling for a range of escalating disciplinary consequences to be used to correct behavior. To improve transparency about the handling of reports, and here the committee pointed to the use of annual reports that provide statistical information on the types of people that have been involved in investigations, how often it resulted in a formal investigation, how long the formal investigation took, how often it was a finding of responsibility versus not, and the types of disciplinary consequences that were given out. And then lastly, the last piece of this is to assess the climate and use climate surveys to measure the prevalence and the problem on your campus rather than relying on formal reports. Okay.
Thank you, Dr. Benya. So we're going to pause here before we move on to our next speakers to get some questions in. And we have a question from Stephen Woods. What are the ways to prevent a person from fearing retaliation?
So one step would be to start actively talking about the ways in which you would protect someone from being retaliated against. So this may tie back to the recommendation about diffusing the power differential between advisors and trainees. If we were to provide some independent funding to graduate students so that they know that they're not wedded, if you will, to one person in the institution that controls both their research area, their financial well-being for the time they're in grad school, and their career prospects, then someone may not fear the retaliation as much. I will note that institutions are starting to think creatively about how to do this. It doesn't need to be a situation where we just wait for funding agencies to address this problem. There's one department at MIT that recently announced they would provide one semester's worth of independent funding to a graduate student that needed to change advisors for any reason. So it does two things. It gives them that financial sort of safety net if they need to change advisors, but it also does not say that you only can earn this if it's because of sexual harassment. So it gives someone an out without labeling them as having experienced sexual harassment.
Thank you. We have another question. Why did the committee focus on changing behavior instead of changing beliefs?
Yeah, so the research is quite clear that you don't actually have to change beliefs to get people to change behavior, and that it's the real goal here with sexual harassment prevention is to actually just get people to change behaviors. And when we've looked at sexual harassment training that exist right now in institutions, the sort of standard training courses that everyone's required to take, those trainings are most often designed to improve knowledge about sexual harassment. They're rarely evaluated. When they are evaluated, they do show an increase in knowledge about what is sexual harassment. But when researchers have looked at whether increased knowledge results in a change in behavior, it shows that it does not. So we need to redesign courses and trainings so that they're about changing behavior. I'll just note that institutions, whether academia or elsewhere, we hold our employees to expectations of behavior for a number of things, whether it's plagiarism or fiscal issues like embezzling money, and we don't necessarily care about whether they have their own beliefs. It's just about whether or not they behave in the way that is expected. So,
thank you. We got another question that I will take the first stab at as a question for AAMC. How does and can AAMC encourage medical schools to adopt these concepts, and does it work to achieve goals beyond salary equity? So I just want to say that AAMC believes that this National Academy's report will advance the discussion among academic medicine leaders and researchers about the steps needed to effectively address sexual and gender harassment. Sexual harassment has no place in medical schools, teaching hospitals, and biomedical research, and we are taking several steps to encourage our member institutions to address this critical issue, including holding sessions at our various constituent meetings, making sexual harassment the topic of our annual leadership forum, co-leading the Society's Consortium on Sexual Harassment in STEM, which we'll talk about a bit later, and creating, as you mentioned, creating a pay equity survey our members can use to assess their own institutions. And if anybody on the webinar or not on the webinar would like to extend their ideas to us, please don't hesitate to reach out and let us know how we may work to help our institutions solve this issue.
And I'll just note, so I was going to mention this and it slipped past my mind, but part of what the National Academies is doing to help ensure that the recommendations from this report are actually implemented and not just sort of considered and then put back on the shelf is that we have worked with a number of academic institutions to launch an action collaborative that will bring together academic institutions and key stakeholders in higher education to move beyond basic legal compliance to the evidence-based policies and practices that can address and prevent sexual harassment and promote a campus climate of civility and respect. And there are over 40 institutions that have joined so far, and this is an activity that will last 4 years long, and we look forward to seeing the creative ideas and the research that comes out of this work.
Thank you, Dr. Benya. So we're going to move on to our next speaker, but I would like to note again that if you have any more questions for Dr. Benya, there'll be another question and answer time at the end. And please just keep adding your questions as we go through the webinar, and we'll get to them as we can. So now I would like to introduce our next speaker, Dr. Reshma Jagsi, who is a Newman Family Professor and Director and Center for Bioethics and Social Sciences and Medicine at the University of Michigan. She will be talking on promoting safe and equitable environments in medicine.
Thank you very much. So it's really a privilege to be here with you today. And what I'll be speaking on is how we at the individual institutions can implement some of these activities. I'm sorry, I am having a little bit of trouble with my slide advancing. There we go. What I wanted to do was place the National Academy's report in context of medicine specifically. And what that report showed us is that female medical students are 220% more likely than students from non-STEM disciplines, and substantially more likely than students in the STEM disciplines to experience sexual harassment when we ask about harassment by faculty or staff. And what you can see here is that this is primarily due to gender harassment and not the tip of the iceberg, as Dr. Benya so nicely described. On the next slide, if someone else can advance for me, I'm sorry, it's not advancing for me. On the next slide is a study of faculty where we asked a question that was asked in a 1995 study. In your professional career, have you encountered unwanted sexual comments, attention, or advances by a superior or colleague? And this was a study that we conducted in 2014 using a Generation X cohort. The mean age in this population was 43, and we asked them this question, and 30% of the women had experienced sexual harassment. This was in comparison to 52% in a cross-sectional academic medical faculty survey that was conducted in 1995. So while things had gotten better, they really hadn't gotten as much better as one might have hoped. Again, in this study, the most common form of harassment was, again, gender harassment. And I will call your attention to the fact that both of the studies that I have shown here have talked about superiors and colleagues and have not talked about patients. And one of the important insights for the medical profession in particular has been the insight that frequently that patients and patient families can actually be the perpetrators of harassment as well. On the next slide is just a calling out of the importance of sexual harassment in medicine and the stories of the individual women. There are very few narratives that have been released, but those that have are very compelling in explaining the reasons for the dry data that you've just seen in my slides and the data that Dr. Benya has presented about why it is just so hard to report in a setting like academic medicine. Women talk about how deeply engaged they've been in their careers and how they don't want to be identified as someone who's reporting sexual harassment. They don't want to be victimized. They don't want to be stigmatized. They don't want to be marginalized, and they certainly don't want to face retaliation. And so those types of solutions that Dr. Benya has discussed that make it a possibility to get out of a difficult situation without necessarily calling public attention to oneself as having been a target of sexual harassment, those types of interventions are extremely important. On the next slide is a list of interventions that can be taken in academic medicine, if we can advance to the next slide. In order to address the strikingly high rates of harassment that we're seeing in medicine, which of course occur for exactly the reasons that Dr. Benya has outlined, women lack in power and authority, even though there are more female matriculants now to medical schools than male matriculants. Women constitute only 16% of deans and department chairs. So to address these strikingly high rates that we see, quite in an expectation of what one would expect to see based on the organizational psychology literature, we have to follow the advice of the organizational psychologists and the insights that they've gained. And we must gather data specifically within our own setting. So these are the climate surveys that Dr. Benya mentioned. And that's super important because not only does every environment vary But those data, and so those data are important to inform the interventions for a specific site, but also the very act of gathering those data helps to demonstrate the commitment of the institution as a whole. And so we at the University of Michigan have conducted these kinds of surveys, and we believe that they really have contributed to a sense that the organization does not tolerate this type of behavior. We absolutely need to facilitate reporting and offer choices, offering not only choices of formal versus informal reporting systems, but also multiple types of complaint handlers who are diverse in every way, including position within the organization, and diverse recognizing that important point that Dr. Benya made about intersectionality and the fact that women of color and women with sexual identities that are not hetero or who have other identities that differ, may they be religious or other, may be more vulnerable. And so having that diversity in complaint handlers is very important. The clarification of policies is incredibly clear because social scientists have shown that the lowest rates of sexual harassment occur in organizations that proactively develop, disseminate, and enforce sexual harassment policy. And we absolutely must address that issue of harassment by patients and families that I have mentioned. And that can be addressed in a variety of ways. One of the ways the University of Michigan has done that is by incorporating a revision of its patient rights and responsibilities document, specifically calling out this particular expectation. And on my final slide, if we can advance to it, we really do need to reiterate that equity is essential. We must together change the structures that are supporting harassment. We must employ more women, promote more women, and integrate more women into every level of our organizations. Our goal must be a well-integrated, structurally egalitarian workplace in which men and women are equally sharing in power and authority. Only in this way are we going to combat the root causes that allow these behaviors to transpire. And so activities on the part of AAMC, including the wonderful work of the Group on Women in Medicine and Science. I see that Diana Lautenberger is dialed in. I hope she'll have an opportunity to speak to some of those activities. Those types of initiatives are incredibly important as well, and I certainly know that at the University of Michigan we've benefited from them. So I'll open it up for some questions at this point.
Thank you, Dr. Jagsy. We'll go ahead and start with a question. I was hoping you could provide some insight onto the key similarities and differences that trainees experience and staff experience in medicine and in research. Dr. Jagsy?
I'm sorry, I was on mute. Sorry, can you, sorry. Okay. And it's not there in the chat box, so can you repeat that?
The question was some of the main similarities and differences that trainees and staff face for sexual harassment between medicine and research.
Medicine and research. So I think that so trainees and staff have some commonalities and some differences, and then research and clinical care also have some commonalities and differences. So let me address those separately. So between the clinical environment and research, there are some similarities that are particularly problematic in biomedical sciences. Those include the hierarchies and the strong dependence on senior mentorship. This is probably more acute in terms of the single mentor in the research environment, because at least in the clinical environment, there is in many settings, at least for trainees, some rotation across different settings. That said, the hierarchies are problematic in both sets of settings, and if anything, in clinical medicine, maybe even more significant. So we have to be mindful of those situations. And then, of course, in the clinical setting, we do have that exposure to patients and patient families. And again, there are situations where individuals are being made to feel unsafe or are repeatedly derogated in front of others, and that is incredibly problematic. There are differences between faculty, staff, and trainees, each of whom have different levels of power and authority within the organization, but all of whom, if they are women, are vulnerable because of the structure of academic medicine and the ways in which our system has resulted in a relative dearth of senior female role models and leaders setting examples, and so that's very problematic.
Thank you. We have some more questions popping up. One is, what training techniques can we use to change behavior?
So I believe that the speaker after me will be talking about some interventions that are very concrete and practical. Interventions that promote civility and respect in the workplace can be very valuable. So there is an intervention called CREW that has actually been tested in hospital environments in Canada that can be useful. Bystander interventions can be very important as well, because bystanders, regardless of their position in the hierarchy, can intervene in different ways. And so those who are not sufficiently senior to report or to directly confront the perpetrator may nevertheless be able to support the target or to remove the target or distract the perpetrator. And so it's very important to empower and equip bystanders with concrete actions that they can use in these settings.
Thank you. We have time for one more question for Dr. Jaxie, but again, at the end, we'll have time for more questions. The question is, do you have any insight into how to address harassment perpetrated by women against other women?
I think this is a very challenging situation, and we certainly do hear this, that women absolutely can be the perpetrators of gender harassment and sexual harassment in the other categories of the iceberg. But women can, in particular, in settings, for example, in surgical settings, where one may have a largely female-dominant staff and a dearth of women who are amongst the surgeons and the faculty, one can see what's been termed pink-on-pink aggression. And this is highly problematic, and again, is behavior that we must call out, call attention to, and then provide bystanders with tools for calling out. So it doesn't need to be a woman who calls this out, but to call out what kinds of behaviors are unacceptable regardless of who the perpetrator is.
Thank you. I see we have some more questions coming in, and again, we'll get to as many as we can at the end of the webinar, and we're going to move on to our next speaker.
Yeah. So our next speaker is Dr. Laura McCabe, who is a past chair and current vice chair of the Faculty Senate at Michigan State University. She's also an advisor of Council of Graduate Students at Michigan State University. She is a member of two of FASEB's member societies, one where she serves as the chair of science policy for the American Physiological Society, and the other as a member of Women in Bone Mineral Research for the American Society of Bone and Mineral Research Society. Dr. McCabe is a professor in the Department of Physiology at Michigan State University, and today she'll be speaking on moving toward addressing gender harassment. Dr. McCabe?
Well, thank you. It's really good to be here to talk about these things. And being the third speaker, you'll see how I think all the speakers have similar lines of thought and its, directionality on this topic. So first, I wanted to talk about how some early steps that universities are taking to address gender harassment. And again, this is through what I've learned being on our faculty senate as well as working with grad students on campus. And some of the things that have come up are clearly the universities trying to provide learning opportunities and open discussions. So this has involved faculty, students, and staff. So it's important to be inclusive in this learning and discussion on these topics. We've also had online training modules like everyone else, and those have included input from faculty and students as they were being developed. There have been town hall sessions where we've included colleges have called these out so that there's students and faculty there speaking up on topics including gender harassment, but overall sexual harassment and diversity inclusion. And what our university has done is developed a new department on prevention, outreach, and education. So this is an area where there have been funds invested to support numerous positions to focus on campus climate improvement. So this group can provide regular presentations to faculty and student governance groups. So they show up in government senate and student council, but also they go to departments where they can focus on specific areas that need more knowledge input. And so what we're finding is we don't have the expertise, and so you have to bring in people who have knowledge, and that's what's led to this hiring of specialists. We have a climate and response specialist now, an online education specialist, a bystander network specialist, so that we can better define, better develop our approaches in these areas. The other thing that the university can do is promote women and diversity, not just women, but this diversity inclusion for awards and leadership position. But this doesn't have to be a top-down approach. This can come from faculty themselves. I've been on group committees where women aren't named as a possible candidate for an award or a position. And so we all can contribute to this at the university level. There's also leadership training where anyone can go to learn about how to be a leader and really change the dynamics, the composition, because we have to have a diverse leadership in order for everyone to feel comfortable on the campus. There have been discussion groups developed by faculty, some directed specifically at women, and we've had mentoring teams are becoming more prominent where we have one person outside of the department so that if somebody, a young faculty hire, has some difficulty within the department, that they can talk to somebody outside the department about this and still be safe. So the other thing that we're looking at are early steps scientific societies are taking to address gender harassment. Oops, so last slide before this. Yes, whoop. Yes. So providing learning opportunities and open discussions at the society level. So both ASBMR and APS that I work with have dedicated staff working in this area. And in fact, at the 2019 experimental biology meeting, there was a combination of two committees within the American Physiology Society that worked together to develop a symposium on sexual harassment. There's also been development of a task force against sexual harassment in the American Physiology Society, and a diversity and inclusion statement and a member code of conduct and core values. And this occurs not only in societies, but also at the department level, at the university level, at college levels. And these aren't just statements, but they're goals that we want to consider when we're making decisions. And I've seen it in committees where people are like, we have these core values, and this approach or this person fits this, and we need to move in this way. And that's the way they should be used. The societies are also promoting awareness. So again, in line with the universities, the societies are promoting social media. There's Twitter links. There were signs at the meeting and emails at Experimental Bio about preventing sexual harassment at the meeting. These societies also promote women for awards and symposia. There's mentoring programs within the society. ASBMR has an excellent mentoring program where the mentor is outside of the state. You know, they're not even in the university, and that's someone that young faculty, postdocs, or grad students can connect with and develop a relationship with and talk about these things with. And then there's the Society Consortium, which FASEB is involved in, and I think they'll talk about that after I talk about this. And so where do we go moving beyond this? So I think, as the other speakers have said, there's data gathering and posting. So climate surveys, while some people think that they're not useful, that because we already know we have a problem. But what they do is help us target what are the differences between this department or that department, and how can we better improve our approach for that department. And the reporting of incidents and how we're dealing with sexual harassment or other reports of harassment are important. There's also been personalized presentations, and this is from our PO department or office, the Prevention, Outreach, and Education. So they're personalizing these presentations to make it specific to the needs of a department. If it's student, faculty, faculty-student problems, faculty-faculty problems, so where does the harassment lie? We have bystander and bias approach, so I've seen some questions about that. But the idea is to empower students and staff and faculty to be active in preventing sexual assault and harassment, and then recognizing implicit bias. We've also expanded our mental health team and safe space, and the ombudsperson is an excellent place to go if students, faculty need to talk something out because they feel they might have a harassment issue. That's a safe place at our campus where you can go and talk it through and get ideas of how to proceed. And finally, our university has professionalism, is looking at using professionalism as one of the metrics that we rate our faculty. And so we've never done this before, but it's becoming clear that we want to work in an environment that is safe and respectful, and this is a metric that we want to include for faculty. And so I think in moving forward, we want to work together to make change happen. And that means the scientific societies, the universities, and us as individuals, have the same goals in mind, and we can enhance each other and develop tools to move forward to make it a safe and comfortable environment that we work in.
Thank you, Dr. McCabe. And due to time, we only have time for one question at this point for you. So there's one that says, is there any data on how family-unfriendly policies like long working hours and increased demand on fewer staff weigh in sexual harassment and female retention or promotion in the organization?
I was just looking at something about that, and I believe that's being looked at. There has been work. I don't know the specific data on that, but I know that the idea is that can we develop a work environment that is more friendly to allow women to succeed? One thing that I've seen happening within the research field is that the idea of working in a team, rather than thinking of ourselves as individual silos and individual labs, but if we work as teams, that we can better manage these things like family issues, if we need to go home, but we can work at home, but part of the team is also in the lab. So one of the things that I've done is I work with another faculty, and so we're co-mentors, and we write MPI grants, and I've seen others doing this as well to help work in family and work.
This is Fraser Benya. I would just add that the report cites some evidence from the Athena Swan program in England, which was designed to improve gender representation in the universities there, and they cite data that showed that female faculty members looking to be hired in universities were more likely to choose universities that had gold or silver level achievements in Athena Swan, and currently the AAAS is recreating Athena Swan in the U.S., and they call it Sea Change.
Thank you. So now,
to follow up on the Societies Consortium that Dr. McCabe touched on briefly, Dr. Ramirez and I wanted to further highlight the recently formed Societies Consortium on Sexual Harassment in STEM, of which both AAMC and FASEB are members. So professional societies have a unique responsibility in their role as standard setters for STEM fields to address the pervasive problem of sexual and gender harassment. So they said this consortium, the founding members are the American Association for Advancement of Science, the American Geophysical Union, and the AAMC. And we had, the consortium had 53 inaugural member societies, including FASEB, and is now, membership is closer to 100 members. And the goal of this consortium is to advance the professional and ethical conduct, climate, and culture across the science and medical fields. We just wanted to bring that to your attention. Go ahead. Okay.
Thank you, Amanda. So now we're going to, after discussing these recommendations, we have this poll where you all get to participate, and you would choose, after discussing this, you get to choose your top 3 implementation strategies. This is live, so if you can start selecting, that would be great. The first one is, what do you think is the most valuable? By hire or promote women, promote civility, provide training that aims to change behavior, provide mentoring networks or community-based advising, access to support services, expansion of mental health, facilitate informal reporting, prevent retaliation, establish clear and transparent policies, assess climate and gather data, provide learning opportunities and open discussions, or promote women for awards, symposia speakers, or editorial boards. And it seems that the top percentage is hire and promote women, followed by provide training that aims to change behavior, and then prevent retaliation and establish a clear and transparent policies.
And similarly, we now have another poll, the same options here, but instead of asking which are the most valuable, we were wondering which are the three implementation strategies do you think will be the most challenging. So again, the options are the same: hire and promote women, promote civility, provide training that aims to change behavior, provide mentoring networks or committee-based advising, access to support services and expansion of mental health, facilitate informal reporting, prevent retaliation, establish clear and transparent policies, assess climate and gather data, provide learning opportunities and open discussions, and promote women for awards, symposia speakers, editorial boards, etc. So it looks like the top choice is prevent retaliation. It seems like that several people will find that the most challenging, and after that is provide training that aims to change behavior, followed by a couple of even hire and promote women, promote civility, assess climate and gather data, and promote women for awards, etc. Okay, thank you.
We would like to thank all the speakers. Oh, actually, sorry. Any questions before we end? I think we have some from before, so I don't know, Amanda, if you...
Sure. So we had one question earlier that we're hoping Dr. Jaxie can answer, although any of our speakers are welcome to respond. There's a question: there are some medical schools with women deans, and there are academic departments with women chairs. Have these schools and departments demonstrated a better track record? And I would probably expand that question to all universities with women in leadership.
So I think it's important for us to recognize that we need women in positions of power and authority throughout. That said, men can be powerful and important allies, and so we shouldn't understate the importance of having individuals in positions of authority who recognize the importance of diversity, equity, inclusion, and promoting safe and equitable and dignified environments within which care is provided. So I think if you look at the social scientific evidence on things like unconscious bias, it turns out that in the CV studies, regardless of whether it's a woman or a man who receives the CV with the name Karen at the top instead of Brian at the top, Karen is less likely to be hired and she's rated as less competent. So I think we have to be very careful about viewing female leadership as a panacea, but do need to recognize that without women in positions of power and authority, we will never reach our goals.
Thank you. And this is Dr. Benya. I can just add that the research that the report cites about male-dominated environments having high risk factors for sexual harassment is based on 30 years of data studying different organizations, and when they measure the prevalence of those organizations, they also ask questions about the environment, about the organizational tolerance, about who's in positions of leadership, and so that's where some of this research about male-dominated environments having high rates of sexual harassment comes from. So it also shows that environments that are less male-dominated have lower rates of sexual harassment.
Thank you. I don't know if Dr. McCabe wants to add anything to that, or we can ask another question.
There is one question. How do you create safe spaces in the workforce when especially dealing with mental health, which can be affected by sexual harassment experiences? And this is for any of our speakers.
So safe spaces within the workplace?
Yes. Or
so
an institution or organization.
I think those come from, again, the ombudsperson is a great place to go because they're not mandatory reporters, and they're a great place to bounce ideas off of, and they can give advice. Actually, this works for any situation, even a student or a faculty. But then there's also, these discussion groups, so female groups, groups that you can meet and discuss topics and work through potential approaches to solve issues that you're facing. People find that helpful.
Thank you. And there's one last question that we have here. Data clearly supports that promoting women into leadership positions can help prevent sexual harassment. However, this may require individuals giving up positions of power. Where are examples of this occurring? How can we reward such behavior? In many institutions, all women are at lower ranks within academia, and deliberate strategies are needed.
So I think there are simple policies that can be put into place that can help facilitate this. So, for example, there are many institutions where there are expectations of term limits in various leadership positions. And when individuals enter those positions with the expectation of term limits, then they're given a forced time clock to make their impact and then allow others to have that position. And so I think term limits are a really important intervention.
Thank you. So with that, we would like to thank all of our speakers for taking the time and participating in today's webinar, and we thank you all also for participating.
So thank you, and with that, we will conclude today's program. Please do fill out the webinar evaluation form that will be popping up on your screen momentarily, or you can use the link in to the evaluation in the links box on the left-hand side of your screen. This presentation has been recorded and will be available within 3 to 5 business days. You may access the recorded archive by using the same login information that you used for today's live webinar. On behalf of the AAMC and our FASEB collaborator, we thank our speakers and, of course, all of today's participants. Have a great afternoon, and you may now disconnect.